Are you tired of quick fixes that promise transformation, but leave you feeling more disconnected from your body than ever before? Welcome to Beyond Medicine, humanized care for women of influence, where we go deeper than surface level solutions. I am Dr. Maria, a functional integrative physician specializing in women's health, metabolic dysfunction, and hormone balance. Here, we will uncover the root causes of insulin resistance, PCOS, thyroid, and adrenal issues, and explore how trauma, stress, and anxiety impact your well being. Because your body's not a microwave, it deserves personalized, compassionate cares that honors its complexity. And today I have with me our returning guest, Lydia Hartwood. The episode that was titled Wounds That Last, Early Trauma, Autoimmunity, and the Mind Body Connection, where we talked about how the events growing up can affect your health and lead to autoimmune disease. And if you do not know what ACEs are, then please go back and listen to the previous episode. And if you listen to that episode, then this one you're going to be very happy because now we're going to tackle it from a little bit of a different perspective. What we're going to be talking about today is trauma as an adult. A lot of the times they say trauma starts in childhood, and a lot of what will happen in your adult years is related to how you grew up and your early childhood trauma, which I think that there is a relationship, yet I also believe that there are some events that can happen in your adult years that are nothing related. And that's what we're going to be talking about today. And then that even if you develop an autoimmune disease in your late 50s, that does not mean that you have to go to the graveyard with that autoimmune disease. So please help me welcome Lydia to the show today. Lydia, if you can start by introducing yourself, what you do in California, and then what are your passions?
Sure. So I am a registered dietitian out of California, like you said, but I did do my internship and I grew up my whole life in Texas. One of my passions is just helping counsel people. I really enjoy the face-to-face interaction. And so one thing that may not be known about me is that I am actually a registered dietitian in several clinical trials. I enjoy the cutting edge of science, and I also enjoy the face-to-face, the personal side of clinical trials and the person that we are studying, not just the drug or the product, right? The human that we're affecting by it. And so how this has opened my eyes to the idea of trauma affecting us. Why does this weight loss drug work for this person, but not this person? Why does this person have trouble controlling their diabetes, but this person's doing just fine? And the big question I've started asking in my clinical trials experience, or even just in my counseling experience, is how are you? What's going on? What has happened in the last year or two? And I can go further back than that, but I start at a year or two because I get a lot of, I used to weigh this. Well, my diabetes used to present this way. I didn't used to have a problem with my joints. And I said, what happened in between used to and now? What happened? And that is a question that requires more than a 15-minute consult. And I suspect that's why it isn't asked more often. You can ask the people I work with. My appointments sometimes extend up to an hour. And I'm sure they're like tapping their foot outside the room, wondering when I'm going to get out. But these questions take time. And so what most people don't know about me is that I've had this wide variety of ICU, maternal fetal medicine, surgeries. But the thing that has helped me the most is actually just asking, how are you? What happened? And giving the patients a chance to actually trust me with the real answer.
Yeah. And I like that and say it's not even about listening in terms of the ear listening. I think that there is this capacity of understanding the story. What
Yes.
happened? Who this person is? What were the events that shaped this person? What are the events that have made it a chaos that perhaps led to that change? And now I cannot manage my diabetes or my numbers, or now it's harder to keep my diet. Whatever that obstacle is, I think that is not only about the listening, but perhaps the curiosity. I'm going to take the time to slow down and not only listen, but become curious without the judgment. Because, and I probably have done it with my patients at some point. I think that sometimes we can just get tired and frustrated, especially when we're seeing a lot of patients per day,
Yes.
where it's just the non-compliant patient. They just do not do what you are telling them to do. And that comes from this position of perhaps judgment, rather than it become from a position of curiosity. So why is it that you cannot do the thing that you know that is beneficial for you? That might open the doors to discover what the true issue is, which is not their diabetes
Yeah.
or their high blood sugar level. So thank you for sharing that. And so let's start to unpack this a little bit more. When you think about trauma in adults, what are some life events that specifically you can see that they're less tied to their childhood trauma?
Sure. Well, because children can't get married, children also can't get divorced. And that is probably one of the main ones I see is sometimes dissolution of a marriage can actually be the start of healing for people, but the divorce itself is a big one that I see in my patients because it's very legally intensive, stressful. You're dealing with the trauma of separation from your best friend or someone who used to be your best friend, which again, used to. That those words carry a lot of weight. They can be very painful. So divorce is a big one. Health problems or the death of a parent, which this can happen obviously as a child, but it's more common when you're an adult. The death of a parent or sibling or other close relative. The other big one is the death of a spouse. Kind of is included in the death of a family, but it is so much more impactful because almost everyone's spouse lives with them and it changes everything about your daily routine and what you do. And then the other thing that I find is a slow burn trauma is finances.
Mm,
That it's very rarely like a one-time event, but it could be like bankruptcy, right? But I think the ongoing slow burn of will we have enough money is just devastating. Because you can't fully relax because you don't know if you're gonna have enough to eat or to pay rent or if your lights are gonna be kept on. And when you do clinical trials, sometimes people do participate in them because they need the money. And you have to obviously screen to make sure you're not being exploitative. I see that a lot, the financial trauma.
So you mentioned a couple of ones that I completely agree, which are relational related. Again, you get into a relationship, things happen, whether it is that your spouse dies unexpectedly, or whether it is that there is a relationship that has broken that you thought that it was not going to broke. And I don't want to even use the word divorce because more and more I know of people that are either are in a relationship and they're not married yet, when they have been living together and it has been a long-term relationship and then it dissolves, but it still has the same impact. I think that also when you mentioned so the death of a parent, I think that one of a big stressors that I would see is when your parent has some sort of illness. And I see this especially with children that are taking care of parents that have dementia.
Yes.
That can be a really big stressor. It can shake things in such a way. And then not only because the caregiving by itself is very challenging, but at the same time, they're seeing their loved one slowly deteriorate and not remember, not even who they are. And I think that also has a really big impact. I also believe that, for example, I lived through the pandemic as an adult. So those things, there are events that, again, are not under your control. I think that sometimes the events that provoke a reaction in our body that we can classify as trauma, right? And scare vermontes that that's what happens in your body. We sometimes want to say that is traumatic, that is not traumatic. Like the outsider wants to put it in the box. Big T, little t. No, that's traumatic. That's not traumatic. Get over it. But again, it's what happens in the individual's body. And something like a pandemic or something as a major natural disaster, I think that those are things that can happen on either side. Yet, if I would have lived as a child through the pandemic, the effect on me was going to be very different than me living through it, being a physician that was seeing patients literally dying in their homes. So I think that also the event can be the same, but depending on when it happens in your life and how close you are to this event can really define the impact that it can have on you.
Absolutely. And I'm glad you also brought up the idea that any sort of break in a relationship, whether it's formal or not, can cause that trauma. The social stigma is it's like the follow-up trauma too. It's like it wasn't enough to just go through whatever illness, whatever thing I went through, whatever relationship, anything I went through. Now I have to deal with the social side of it. So, for example, the caregiver trauma is such a real one. And that's also a question I ask patients is who are you responsible for caring for? I don't ask if they have children because that does not actually cover the whole story. Because they may have adults, children that they care for. They may have adult parents they care for. They may have an aunt, uncle, sibling they care for. And so when then there's not just the I care for this person and I can't fully relax. It's now socially, I'm cut off from people or people don't understand or I can't go out with these people. So I lose that relationship with them because I am this caregiver. We can't tell somebody that was or was not traumatic for you because you don't live in that body. What affects me may not affect you and vice versa. When during the pandemic, when I worked in the ICU, I walked in one day and there was all the beds were empty because everyone had died. Everybody. And for some of the doctors there, that's just how it was. But for me, I remember the calendar day that happened because I had never seen death on that scale in person before. And
Right.
so now I would say that would impact me differently because I've already experienced it. But you could look at that and say, that wasn't traumatic. But how do you know? You weren't there in this body. So, yeah, it can be difficult to pin down the word trauma. And a lot of people do not want to use that word because they're concerned that it's overused or they're concerned
Yeah.
it makes them weaker, that something traumatized them. Have you experienced that kind of aversion to the word?
Trauma, absolutely. And I would say, even more than any shame attached to it, more and more what I'm seeing is this we're overusing the word trauma, and not everything is traumatic. Like, again, they need to get over it. Why don't they get over it? They need to put on their big boy pants and their big girl skirt. And a lot more of what I hear is this resistance to actually look, have compassion, but then also to really look at that's their body. That's how they're experiencing the event. That's the effect. One of the things that can lead to trauma is the sense of they're taking power over me. So then by you coming from the outside and telling them, no, you need to get over it. No, that's not traumatic. What you're doing is even taking out even more of that power and more of that autonomy. So you're not even helping them heal. You're actually putting more dirt into the graveyard. That's really what you're doing. And then also, I think that it comes from a resistance of wanting to look at us as a society, a whole unit. And the reality is that There are some things in systems of oppression, and sometimes we are part of a system that can create oppression. And being part of a system that creates oppression will always lead to an inequality that will lead to people experiencing stress, especially chronic stress. Sometimes when we stay quiet, we're also part of it. It's kind of like if you are witnessing somebody get assaulted, any type of assault, and you're not doing it, but then you don't do anything to protect that person, whether that is because you fear for your own life or whether that it is because you're like, well, I'm just going to look the other way. Whatever decision is, there's also a reason why you're doing that behavior. All behavior always have a reason. But when you choose to do that, then for me, you are part of that assault.
There's a lot of this in medicine. There is a lot of weight bias, and there is documentation of race bias as well, and even gender and sex bias. And that can go both ways, actually. But the thing that I have fought a lot is this idea that certain races of people have higher pain tolerance. Another big one is that if you are overweight, you don't need the same amount of nutrition intervention in the ICU, which is false. Just because you have extra weight on you does not mean that extra weight is going to help you in a state of acute inflammation, to waste away, to not have lean body mass losses. I fought that so much in the ICU. My patients who were at higher body weights did not get as good of care, I felt, by the physicians, because I think there was also this element of, well, they deserve to be here because their decisions led to this. And that is
Mhm.
so re-traumatizing to say, not only did this horrible thing happen to you, but you actually deserve it. And we're not going to help you get out of it. It
Yeah.
was shocking to see. And I made many reports about what I saw and documented thoroughly in hopes that these patterns would stop.
Yes. It's like when you got assaulted, well, what were you doing there? Who in their right mind? So again, we re-victimize the victim. And I think that's very common. And I don't want to say necessarily here in the United States. I think that because I don't know the statistics and I cannot compare them. But for me, it's very common. I am going to re-victimize the victim. And I don't know why, as a society, it's easier to do that, to put the responsibility on the person that was the victim of an event rather than to put the responsibility on the person that inflicted the danger or the harm. And then look at it also from that broader perspective of the one at fault is actually the one that assaulted the person that was walking at midnight, but also all the neighbors that heard the assault and that nobody actually woke up, took their phone, called 911. So I think that again, sometimes it's just that we have this challenge of looking inside ourselves because looking inside ourselves and our behaviors is a little bit dangerous. And I know that we're going a little bit off topic, but it's a little bit dangerous because then if I look inside myself, then that's where the chain is going to kick in because maybe I should have called. Yes, it woke me up, but for whatever reason, I just wanted to go back to sleep and I just didn't take the phone and call 911. And that will trigger shame. So sometimes we resist self examination because of the shame that the people or the person that is healing from trauma is dealing with. We all deal with shame.
I love that you keep using the word heal, because when I talk to patients, they say, I need to fix this. And I know it's a small difference in language, but the difference between fixing and healing, I need to change the oil in my car. Let's use that example. If I leave it in the driveway, will it get fixed? You have to go take it to get fixed. And we as humans take for granted that in general, our bodies heal themselves. If I get a cut and I just sit here, it should heal. And healing is different than fixing. But even healing has its limits without outside factor.
Or help.
Yes, that's the word. There's a 1974 article called The Skeleton in the Hospital Closet, and it talks about how vitamin C deficiencies and other nutrient deficiencies were causing wounds not to heal. We just take for granted that wounds heal. But in a hospital setting, when wounds are severe, we know that it takes a team, it takes interventions. A big thing with trauma is I should be able to deal with this. Can't I fix this? Why do I don't want a therapist? I should be able to do this by myself. But
Yeah.
we know that with physical wounds, we know that if I do a paper cut, it'll heal. But if I have a big wound, everybody knows we need to go to the hospital and get a team. So, what if trauma is just a big wound? Why do we expect it to heal by itself? And why do we think we can fix it like a car? It's not just exchange part A for part B.
No. And when you're talking about the wound, I also think about the scar.
Yes.
So there is a scar, there's an evidence, there's a story. And not only that, depending on where in your body that injury is, skin versus tendons, ligaments, muscles, both. Just to mention a couple, healing process looks so different. The time that it will take to heal, what you maybe are able to do versus not able to do, if it's more superficial in the skin versus if it involves tendons, ligaments. And I think that again, sometimes we are so used to addressing the physical only as the physical is the only thing that needs healing. Yet, surgeons have the fixing mindset, right? So when you deal with surgeons, surgeons are like, I'm going to fix you. Because frankly, they might come in and drill your bones together. They might come in and put a metal implant, a knee or a hip. They might come in and maybe help those ligaments, tendons, right? They might come in and remove that organ of your body that has cancer cells. Yet there is a process that even after the surgery, and there is here that there's a different way that you eat, you change your lifestyle. And we can accept that in such a more easier way is the word that comes. But when it comes to the emotional, spiritual wounds, because traumatic events can have a spiritual, very deep into the core of who you are. And I think that that's why sometimes healing can take time because it's not only about the mind and what's going up here, but then it's what's going on the core of who you are. So we can deal with that so much easier than deal with this other aspect. And I'm not sure why. I don't know. I'm sure if it's Western culture or just the fact that the physical is easier to see, quantify, but it's just a different approach that we have as humans, not only healthcare clinicians, but then also from the patient perspective.
Yeah, I think in a desire to be more scientific and more concrete, we ignore what may be the most important part of ourselves, which is the part that we don't see. And you don't have to be religious to believe that we are more than just a meat sack with an electrical jello in our head. Like, you can definitely understand that people are hesitant to believe in a higher power. That's
Right.
not necessarily what I'm talking about. It's talking about the fact that we're not just chemicals in a meat suit. And that I think we view as a lot of times in society as unscientific. I know I've gotten a lot of flack for being religious in science. And I just think that it enhances a lot of what I see in people when I actually talk to them. The science is so important, but the person is the person we're doing the science for. So when I ask them, how are you doing? They start listing facts. They say, business is good and my kids are almost out of the house. And I'm like, that's not what I asked. That's what are you doing? I'm asking, how are you doing?
Yeah.
That is a You mentioned, I think you said the word dangerous. It's a dangerous question because we have to really look and see what is, if we pull back the curtain, what's back, what did we shove back there thinking we could deal with it later that now we have to deal with because we're out of room.
Yeah. So we started to talk about healing and how healing
Yeah.
is different than fixing. So let's talk a little bit more about that.
Yeah.
So let's say that again, in your adult years of developing yourself as grandpa, grandma, or just a retiree that is just going to be traveling the world, or maybe just at home doing nothing because that's what you want to do. What are perhaps some things that adults compare to children or young adults? So let's talk maybe people past their 40s, right? So midlife, what we would call like midlife. So people that find themselves past 40 in whether it is in the midst of it. So again, the caregiver of the adult parent that has dementia, right? They're still in the midst of it. Or maybe I just lost my spouse 2 weeks ago. So, what are some tools that we can use to help in this healing process that will take time, will take care, and will take help?
Well, I said in the last podcast that healing starts with curiosity. And I want to maybe add to that. It starts with curiosity and courage. And the reason I say courage is because if you have a spouse die or you have a really difficult parent caregiver situation, it takes a lot to look at yourself and go, who am I and what is going on in my brain? Because it's exhausting. It's a time commitment. You can't just do that on a Tuesday. It has to be an everyday process. And so healing starts with that desire to wonder if things could be better or different, if things could be more authentic, if things could be less painful. And to do that as an adult, you have to make the time. And I think that is really hard because if you look at someone's day who is 45, works, and takes care of mom or dad, that is a very full day. And then their kid has an issue, so they call. And then, oh, this bill didn't get paid, so now I have to figure that out. Suddenly your whole day is gone. And I think that the first roadblock that people meet is, how do I have time to heal? And certainly if therapy or some kind of intervention that involves healthcare professionals or mental health professionals, those interventions, to take the time out of your day to do them and the money for a lot of those things, those are very difficult things to overcome. But the thing I always tell patients is start. Maybe we have to put a pause while mom is in the ICU on really digging and we're going back to surviving. But in any moment that you're not merely surviving, let's start to explore. Whether it's with a professional, which does not mean you're crazy. If you're crazy, then I'm crazy. It just means that we need a team. If you needed something on your house fixed and you did not know how to do it, you would go hire somebody. Doesn't mean that you should know how to put siding on the side of the house. Maybe actually it's okay that not everyone knows how to do it. It's okay to hire somebody. So yeah, in those moments where you feel that you have some time to breathe, use that time to explore. But if you have no time and there is no end in sight, I think that the hard thing to say is maybe this isn't sustainable and whatever you have now is not going to work in the long term. I'm not saying if something happened, like mom in the ICU, right? There, that will have a resolution, hopefully, one way or another. But if you're a caregiver, that's indefinite. You have to ask yourself, is this sustainable? Why can't I work on myself or have time to do literally anything else for the past 5 years? And will that be 5 to 10 more years of this? Can I do 5 to 10 years more of this? So, do you find, Dr. Maria, that people are engaging in unsustainable behaviors and those behaviors seem like they're indefinite? And that's why it's hard to even get started on the journey?
I think that I do see some of that, I would say, for different reasons.
Sure.
One, for example, when we're talking about being the adult caregiver of a parent that has a terminal illness, like dementia, for example, there is a couple of things that they're struggling with at the same time, which is if I cannot take care of mom or dad, then I am abandoning them. And then they're dealing with this, even this feeling of I am abandoning them. I'm not doing the right thing as a child. Sometimes there is financial reasons that they decide to be the caregiver. Their parents maybe did not pay Medicare, Social Security. There is highly costly in this country, and they don't have the financial resources. So then they say, I'm going to be the caregiver, but then that comes with a huge change in their lifestyle. And as you said, indefinitely. And then there is the burnout that comes with it. And when they start to burn out, then they start to feel like I am not strong enough. I shouldn't burn out. And I have even had parents that or kids, right? Like the adult child tells me, well, but they were able to take care of me when I was growing up until I was a toddler. And I was like, yes. And in this case, there was a beginning and an end to your like kind of like toddler years and being, nursing. And for whatever reason, I think that in society, there is more help for parents when they have a newborn. And what I
Yeah.
mean by that is sometimes in families, things have happened, dynamics have changed. And a lot of the times, what I see is that even if there's more than one adult child, usually there's only one that takes to bear the weight of what's going on for multiple reasons. And when their parents had a newborn, there were aunts and uncles, grandparents. Everybody was coming. Everybody's celebrating this newborn and healthy. And they throw you a baby shower. And so I think that that is very different. I think that also part of what happens is the demands that society and culture have put on us that at any adult stage of your life, I think that you really have to reconsider. I hear a lot of people having multiple jobs because the economy has changed, because this has changed and all of that. And I think that sometimes we do have to step back and say, is what I demanding of my body, this is the way that I would put it, is it something that my body was designed to do? Was my body designed to work 60 to 80 hours a week? And can I do that? Maybe I can do that for 2 to 3 days, but can I do that for 5, 10 years? Was our body designed so that we always eat while we're multitasking? And I can continue to give you examples. Was our body designed so that we sleep 5 to 6 hours? A lot of people tell me. And sometimes it's hard because we're living in this culture that is demanding that of us. And I think the more you try to live outside those standards and outside that pressure, then that also means that the more you will feel like an asylum, to say it that way. So I don't know what your thoughts are on that, but those are thoughts that come to my mind.
Yeah. That I see it with younger adult patients as overscheduling, what for their children or for themselves. And I recognize it even in myself. When I was in grad school, I worked like 60 hours a week and went to school. And I did that for 2 years and destroyed my health. And granted, I got no debt from grad school, none. It was
Mm.
an incredible feat, but sometimes I wonder if I would rather be paying a student loan than dealing with the fact that now I have to take Tums when I eat too much because I've destroyed my, like, due to stress, I had stomach ulcers and now my lower esophagus is so weak that I get heartburn at the ripe age of 27. So I haven't had no kids, and that's just my body now. And sometimes I wonder if I could go back, would I tell myself, just take the student loan payment, just enjoy grad school? It's okay. I sometimes wonder if I would say that to myself. But then I continue to try and overschedule because of the demand, right? The demand of the economy, the demand of society. And there are some situations where those two job, very stressful situations are necessary in the short term to survive. But we should not, our bodies were not intended, I should say, to survive forever, indefinitely. And Dr. Edith Eger talks a lot about this as a Holocaust survivor in her book, The Choice. And she talks about you can't survive forever because eventually the act of surviving kills you. Because it's like, it's just hard on your body. It's hard on the tissues that make up your body to constantly be in that state. And I know it feels unavoidable. I know that it feels like this is the only way to make things work. But the number one tip I have for patients is really examine your life. Really examine it. Is all of this necessary? And some of it is, but not all of it. I have patients who are lawyers who are destroying their health. And I'm like, do you need to take that many cases? Can you work for a different law firm that prioritizes work-life balance? Because I have lawyers who have heart attacks at 38. You think, but I need to have this money for my family. Well, if you died, you're not going to have any money coming in unless you have good life insurance. So it's hard to zoom out because it feels so necessary. It felt so necessary to not have any debt from grad school. It felt so responsible. Everyone was telling me how responsible I was. But I didn't zoom out. I didn't think, what's this going to do to me? But everyone marvels at how productive I am. Maybe I should have been less productive.
And that's the same thing that I say about medical training.
Yes.
Medical training, residency, what is demanded and what we demand of our bodies. And I think that, again, one of the decisions that I have made is I'm not going to continue to do this now that I have finished my training. But then that also comes with choices. And I understand that not all physicians make that choice, and that's okay. I'm not going to judge them either. And I think that's also very important. So as we come to the end, and I know that we went a little bit of talking about some things and all over the place, but I love our conversation. But it's specifically about this topic about trauma in your adult years, especially midlife and healing. Are they any last word of wisdoms that you want to leave our listeners with?
Sure. I know it may be frustrating to listen to me not have any concrete actionable steps. 1, 2, 3, here's how you fix your life. Any person that says, here's how you fix your life, I would have just a smidge of caution because there is no one size. But I will say that the pattern can look similar. The first thing I would do is get yourself a team if you can. That team may look like community. It may look like your church or a club or your peers, your coworkers, but some kind of reliable community or team who can help you unpack this. You don't need to do it on your own. In fact, you probably shouldn't do it on your own because it may be hard to step outside of your body and actually see what's going on. We all know that other people see us differently than we see ourselves because they are able to look at things we necessarily can't see. So just consider getting yourself a team, paid or unpaid. The second thing I would consider is take a really good look at your life patterns and ask yourself, can I do this for 10 years? We do this in marriages and in relationships. We say, and like relationships with our siblings, can I do this for 10 years, for 20 years, for the rest of my life? No. Then it's time for a change. The third thing I would recommend is not just being curious about your story, but being curious about the habits that may be barriers to discovering what's going on. So, just one example. I always ask about sleep hygiene. Everyone who comes to my clinical trials want to lose weight. And the first thing I ask is, how do you sleep? Because that is the foundation. So, look at those foundational things, beliefs about yourself. I'll try and make it brief. There was a psychological experiment where we put like marks and scars on people's faces and said, we're going to go in for a fake interview because we want to see how scars affect how people hire. But they didn't tell the patients that they removed. So they showed the patients the scars with the makeup, right? And then they removed it without telling the patient and without having a mirror. The patients who went in thinking they had a scarred up face did worse in the interview, had less confident posture. They were less able to answer the questions. And I may be misquoting it a little bit, but the idea is they were not performing as well because of the way they perceived themselves.
Yes.
And it's hard to prove that with qualitative science, but I think that is a great place to start is what do I believe about myself? Do I believe that I deserve to feel better? I ask patients, what would you want for your children? The ones that are like, I can't go and work out because then that's less time with my toddler. Well, I'm pretty sure a toddler would like a 50-year-old parent who can hike with them when they are an adult. Zoom out. Look at those big overarching foundational beliefs and habits. Sleep, eating. If you're skipping 3 meals a day and then eating a huge meal at night, look at that habit and say, not with shame, but with curiosity. Why do I feel that this is what I deserve? That I don't deserve 15 minutes to sit and eat? Just looking at those overarching things. It starts with curiosity. But if you look at those things, you'll start to see that you would never expect that of another person.
Yeah.
You would never tell a friend you should skip 3 meals a day and then get 4 hours of sleep.
No.
And so I wish I had an explicit, here's the formula, here's how you fix it. But there are some things that can be fixed, right? Like a joint replacement. We can fix the joint. But I can't make you go to PT afterwards. I can't make you change things in your life to make that joint replacement easier. I can't force you to recover, to heal. Can't fix it. You have to do it. But you can, and tons of people do. And you can teach old dogs new tricks. I rescued dogs, I know that, and I know that people have the same brain chemistry.
Yes.
We can, but the effort. What's preventing the effort? And it's very valid things usually. But I've seen some amazing transformations of people. In the clinical trials, the drugs help, but the real thing is the mindset change. There's such a big difference. I can tell who's ready and who did it. And it's not just in the numbers on the scale or in the lab values. It's the way they carry themselves into that appointment. They're wearing brighter colors. They're smiling. They know what they want now and where they could go. And the things that felt impossible to them a couple months prior are already here. So if those impossible things are already here, what else is possible?
Absolutely.
What a great question to ask. What is possible?
Yes. And that's where hope, once we are able to regain that sense of hope, that healing has started to happen when
Yes.
we regain that hope. So thank you for this wonderful conversation, Lydia. I will put information about Lydia on the show notes in case you're curious about what she does, if you can work with her, or maybe just how to connect with her and follow her so that you can continue to learn a little bit more about the work that she is doing and what she is learning as she continues to work with patients. So, Lydia, thank you for being today with us. This has been a wonderful conversation, and I am so glad that we ended up with the possibility of hope because more people in this world needs hope. Until next time, everybody. Thank you.